Hi and welcome to a new episode of your weekly medical TV show on Al-Karma TV, White Coat. Today we'll talk about one of the most important organs in our body, which is our skin. We'll talk about skin care and how to deal with the wrinkles and loss of volume in our skin, especially in the cheeks through Botox and fillers. But the first question would pop up in our mind is why we get those wrinkles from the beginning. And the answer is the wrinkles are a natural part of aging process. As people get older, their skin gets thinner, drier, and less elastic due to collagen loses its own nature and be less able to protect itself from damage. This leads to wrinkles, creases, and lines on the skin. Today, we'll have some live procedures of Botox, injections, and fillers, and it's my pleasure to welcome back in White Coat Dr. Javier Reyes. He's one of the outstanding physicians in Southern California and the owner of Magnolia Skincare Clinic. For interaction with the program, send in all your questions and concerns to our official Facebook page, White Coat Al-Karma TV, or if you want to interact directly with my guest, you can call the numbers that will be shown on the screen at any time during the episode, and we will be more than happy to answer all your questions.
Hello, I am Dr. Rios, and I am a family practice physician and the medical director of Family Medical Clinics in Riverside, California. I've been practicing family practice for the last 20 years, and today our group has more than 20 providers. We offer primary care services like family practice, pediatrics, geriatrics, OBGYN, and many other services for the community. My mission is to offer services to the less privileged people in the area, and we're very happy to serve our communities. I went to the medical school in Mexico City, and I finished my post-degrees in Los Angeles, California, and since then I've been serving the community of Riverside, California, and San Bernardino since 1998. My passion is cooking, playing racquetball, and also doing a little jogging. Keep watching White Coat on Al-Karma TV.
It's my pleasure and honor to welcome back in White Coat Dr. Reyes, one of White Coat family now. Welcome back, Dr. Reyes.
Thank you very much for having me.
A very important topic today, the skin health and the skin care. And we'll do the Botox and fillers live, right? We have two cases.
That's right.
In the beginning, can you explain to us what are the enemies for our skin that can cause damage and wrinkles? Why the wrinkles happen, the process of wrinkles, how it happens, and the enemies for our skin?
Yes, the principal problem on the wrinkle is that we lose collagen, which is an important component of our skin texture.
Okay.
Collagen is very sensitive to certain products or elements, and one of the most important one is the sun or UV lights.
Okay.
And that's the main enemy for the skin.
Okay, so I'll stop you here with the first enemy to our skin, which is the sunlight or the ultraviolet rays. How we protect ourselves from this?
Main thing is protect it from the sun as much as you can, directly with a hat or sunscreens, and try to avoid sun exposure, direct sun exposure, as much as you can.
Do you have a certain SPF for those kind of sunblocks?
So the SPA is not really the main thing, or the main issue is how frequently you use.
Okay.
So it's crucial to use the sunscreen 30 minutes before you go to the sun, and then after that, repeatedly, like maybe every 4 hours or every 3 hours. Many people use the sunscreen right when they are in the sun.
Okay.
So we just need like 5-10 minutes to have the damage. So if you use the sunscreen
Sunblock.
just on time, it will be too late.
Are we related to certain number here for the SPF, or you said it
So we
doesn't
like
matter?
the 40, which is the most common one. Some products are higher, but that does not mean the higher is better. Once again, the most important thing is how frequent you use the sunscreen.
Okay. What are other enemies for the skin that we're talking about?
There are other important enemies for the skin. One of them is smoking.
Okay.
Smoking is extremely serious about the skin. Another one that is becoming very popular is pollution, lack of sleep. One that we just discovered not long ago, which is sugar. Sugar has been demonstrated to have damage in the skin. And remember, sugar is not only as a sugar that you eat, but also other carbohydrates that become sugars like
Sodas and...
Yeah.
Okay. What else besides those stuff that we can avoid as much as we can?
So there are other associations like drinking and straw that creates some, we call it the smoker lines, but it can actually come from people that likes to drink from a straw, and definitely dry skin.
Okay. What about weight gain and weight loss? Sometimes the elasticity can cause wrinkles?
It can cause wrinkles, but the body is so smart that it will actually recuperate if that's only your problem.
Okay.
So that really doesn't really affect.
It just came up to my mind because we got a question here saying, is weight gain and weight loss like the yo-yo effect of...
Yes, it is, but if you lose weight very fast, you're going to have wrinkles, but over time, these wrinkles are going to disappear if you don't have any one of those damages elements.
So we keep hearing about Botox. Like, what is Botox or Dysport?
So there are several products in the country and around the world. The main ones is Botox and Dysport, and they are nothing but a neurotoxin.
Okay.
And if I can show my screen in the TV,
slide 3, yeah.
I can explain in more detail. So Botox is actually the most popular. I prefer Dysport, but everybody is different. And it's only a neurotoxin.
Okay.
And this neurotoxin is capable to block some of the connections between the nerves and the muscle.
Okay.
So when this happens, then the muscle is not able to contract anymore, and then the wrinkle disappear.
Okay, so muscle contraction causes wrinkles, and we block that connection between the nerve and the muscle.
Yeah, and this is not really related to sun itself, but this is more like the constant contraction of the muscle that creates the wrinkle. So we put the muscle to sleep, and the wrinkle disappear.
We got some questions in our social media. Is every single kind of wrinkle would be able to be treated by Botox or Dysport?
No. The wrinkles that are associated with sun exposure or any other aggressive element are not responding to Dysport or Botox. Okay. It's only used for this kind of wrinkles.
Okay. How can we tell, like, what kind of wrinkles would be?
So we already know that the most common wrinkles associated with this constant contraction is the ones that are in the glabellar area, which is the forehead. The forehead create this constant contraction of the muscles. These muscles that we have in this section makes our face look angry and sometimes stressful, and then we get this what is called the 11 light or the witch line.
Right.
And this is a common problem among all of us. The older we get, the worse the wrinkle. So what we do is that we inject this substance in this area, and the muscle cannot contract anymore.
Okay. Can other wrinkles and other parts in the face can be injected too?
Yes.
As well?
FDA just approved the crow's feet, which is the wrinkles that appears next
around
to the
eyes. Okay.
And some physicians and other practices are using these products for the lower face. It's really not indicated. I personally don't do it, but it has been associated with some serious side effects like biting yourself or other problems.
But I want to confirm one point here for our viewers. You're telling us now that the wrinkles either here or here, it's FDA approved.
It is.
Okay. I'm curious, how does it feel, like during injections? Is it painful? Is it?
So it's a very simple procedure. It's like a prank. We use one of the smallest needles on the market, usually gauge 28, which is extremely small. So there's a little sensation of like a bee sting, like or maybe a prank.
Okay. So how many settings does the patient need, or how much of those like Botox or injection does the patient need?
So we deliver the product based on units, and everybody needs different amount of units according to the size of the muscle. The bigger the muscle, especially like in men, the higher the doses that they need.
Okay.
The smaller the muscle, they need less units.
Can it be done in one setting, for example,
setting,
or
yes.
you need multiple settings?
No, we usually do one setting. Occasionally, patients need a touch-up later on, but it's actually just one setting. And then we do it every 3 months or every 6 months after all.
Is there any side effects for those injection expected?
Yeah, there are some side effects. Probably the most important is to know that you receive the treatment with a certified physician or a nurse practitioner. In the United States, only these people can give the product.
So you're telling me if you're not a physician or nurse practitioner certified to do it, all those cosmetic places are not licensed to do it?
No, they're not licensed, and that's not right.
So it has to be under the supervision of
Of a
a physician. Okay, perfect. So what are the side effects expected?
So there are some minor side effects. One of them is swelling, tenderness, some bruises, and redness due to the injection. Can I show my screen number 7?
Slide 7, yeah.
7. So you can see that swelling is probably one of the most common ones. There are other ones that are not that common, but they are serious. And one of them is called ptosis or eye drooping.
Okay.
That happens very rare, but occasionally happens. So basically, somehow the product goes to the lower part of the eye, and it produces this eye drooping. The good news is that usually disappear, and then it goes away eventually.
Okay.
Other problems that we see is headaches, and there are other issues like numbness. We haven't had any kind of serious side effect for the last 12 years that I've been doing this, but it does happen.
Okay. How big is the swelling or the bruise?
It's a tiny swelling. It's nothing significant, and it usually goes away in maybe 1 or 2 days.
Okay. What are the precautions we need to know before injection? Is it for everybody? When should we do it if we're planning to?
No, it is not for everybody. We have certain rules, and if I can show you my screen number 8, you can see that we don't do it in breastfeeding moms and also pregnant. We try to stay away from that. And then I can also show you another precautions that we do in the next slide. But basically, this is one of the main contraindications. And some people that have some chronic medical problems like skin cancer or some serious bleeding disorders.
Okay. How long do we need to do it before, like if I have an event and I need to do it or to get it done, how long do we need to do it before the event?
So we like to do it at least 1 or 2 months because there is always the risk of some side effects. So if you're going to have a wedding or something important in your life, it's better to do the procedure at least 2 months.
Okay. سريعا عشان انا عارف ان احنا محتاجين نعمل البروسيجرز دي. مهم جدا ان حضراتكم تعرفوا ان السيدات الحوامل، السيدات اللي بترضع ما نقدرش نعمل فيهم عمليه البوتوكس. حاجه مهمه تانية، اذا حضرتك عندك سوشيال ايفنت او مناسبه اجتماعيه معينه وحضرتك بتخطط ان انت تروح المناسبه دي بشكل افضل من غير تجاعيد او ترهلات، مهم ان حضرتك تعرف ان انت تخطط ان انت تعمل الموضوع ده شهر او 2 قبلها، لانه ده مهم جدا انه تروح طبيعي جدا بدون اي مشاكل. How do we prepare the patient for the procedure?
So there are minor preparations that we need to do. One of them is that we need to do a complete physical examination on the patient and find out if there is a specific contraindication. And if not, then we ask the patient to do certain preparations. So one of them is that we try to keep them away from any kind of skincare treatments like retinol A, glycolic acid, and other kind of more aggressive skin creams or lotions. We like them to stay away from the sun or any kind of skincare treatments like peeling or other kind of treatments like tracing and treatments in the face.
Okay. What about the makeup before?
So we usually remove the makeup at the time of the procedure, and then they can continue using the makeup right after.
Okay.
We like to keep them away from alcohol at least 24 hours before and 24 hours after.
Okay. My last question before we do one of our patient life, what's the follow-up and the post-treatment care? How much do I need to follow up with you after the injection?
So we always recommend our patients to minimize heavy activities or heavy duty exercise, no massages, stay away from the sun, no alcohol, and then call us if there is any complication like severe pain, numbness, or headaches.
How about rubbing and massaging?
So massage is not recommended because we just inject something in the face, so we don't recommend any facial massage because that can disseminate the product where areas that you don't like to be.
Okay. Let's get in business, get one of our patients, let's do it live and show our viewers what does it feel, how can we do it, and the follow-up, and we'll discuss it with the patient, how does she feel right after.
Okay.
Right? Okay, let's get in business. هنرجع مع حضراتكم، هناخد فاصل بسرعة ونرجع مع أول مريضة هنعمل لها حقن البوتوكس لايف قدام حضراتكم. حضراتكم هتشوفوا كل العملية بتتم ازاي من الأول للآخر. هنناقش المريضة كمان هي حاسة بإيه في الموضوع ده. ناخد فاصل ونرجع مع حضراتكم. I would like to welcome in white coat Nora Manzo, the office manager.
Thank you so much. Thank you.
And Maricela, our patient for the day. Welcome to white coat.
Thank you.
والحقيقة النهاردة Nora, you told me about a gift. You want to give it to our viewers today?
Yeah, we want to give 20% off to everybody that calls here, and they're going to give you guys a code, so we
Okay.
can give you that special.
What do you want the code to be? White coat?
White code, please.
Okay,
White
perfect.
code.
اللي هو 951. What's the phone number?
It's 951-588-1652.
Very quick about the products that you guys have in the clinic. Do you recommend any of those? People can buy directly from the website, or they have to call you, and what kind of products do you recommend?
We do. They can call us, and they can actually do the Botox, Dysport, fillers. We do other kind of treatments. We treat the brown spots.
Okay.
We also treat the acne scars. We do facials. We do fillers. We also treat the spider veins, skin tags, and a lot more.
Okay. Do you recommend certain kind of products on the website that people can buy for their skincare?
So we have a number of products in the market and on our clinic. One of the most common ones and very popular is the ones that contain hyaluronic acid, like Episilk.
Okay.
That
Which one of those? The Episilk?
It's not there, but Episilk is becoming very popular around the world because it has the actual component of one of the elements of the collagen.
Okay. Let's get in business. I'll let you prepare the patient and explain like how do you start, and I'm just going to translate.
Okay.
Awesome.
Okay, so let's start.
So Maricela is a real patient, and we have a real product, so this is all true.
Okay.
She has been receiving treatments with Dysport, right?
Dysport.
Never Botox?
No Botox.
So people that use Dysport can take Botox, or people that are using Dysport can switch to Dysport either way.
Okay, so let's get in business and start.
Okay. So the main problem with her is the wrinkles in the upper face, which is the forehead, and also the crow's feet that are in the sides of the eyes.
Okay.
So can you please show me your muscles? You can see these muscles that are very strong,
Okay.
and she seems to
So
be.
if you can look up a little bit to the camera, so that, yeah.
So look up like this and show me your muscles. So see these muscles, they are creating these wrinkles.
Okay.
And she had a treatment not long time ago, so you don't really see it very much.
Okay.
But these muscles that are here are creating these wrinkles here.
Okay.
And if you smile, show me your wrinkles on the side. Smile more, so you can see this crow's feet, and the other way, you can see the crow's feet. So those are the FDA approved for Dysport or Botox.
Okay.
So anything
So
that is.
We
Yeah.
talked about preparing the patient and the precautions that she can do. Usually you start up by removing the makeup, right? That's the
So
first step.
we remove the makeup in the areas that we're going to inject.
Okay.
We initially do a complete physical exam to make sure that she doesn't have any one of the contraindications that we just talked about. And if everything is ready to go, then we do the procedure. The procedure is very simple. Everybody is different. Some people like to keep the patient in the table. Some people like to keep the patient standing up like this. I prefer like that because I have a way to see where the wrinkle is.
Broader
But like I
area.
say, everybody's different.
Okay, perfect. Okay, let's start.
So we're going to start cleaning. We're going to clean her up a little bit.
Just the crossfit and glabellar muscle. So one more thing I want to mention is that when we numb these muscles here, then we have a side effect, which is a good thing because these muscles are going to be numb and the muscles next to it are going to have no opposition. So you're going to see this eyebrow go up.
Okay.
So a lot of people use the Botox just to make the eyebrow
Okay.
higher, and then it gives you a more bigger eye, which is a good thing. But sometimes this can be too much Botox, and then you have this eyes way too big. When that happens, then the patient may need a touch up to fix the difference.
To relax the muscle a little
Sure.
bit.
Okay, let's start, and we'll ask you about your experience. How do you feel? And we'll ask Nora about the experiential side of all this.
Just for a second. So another thing I want to mention is that there's some transversal line that some people may have, especially when they lift their eyes too much, and then these lines can also be treated
equalized.
with the Dysport or Botox.
Okay.
She doesn't have any one of them. That's why we're not going to treat it. We're just going to treat this muscle.
I want to show him the needle first
Yeah.
before you start.
So this is a very tiny needle. It's extremely.
نقدر نعمل زوم شوية أو نقرب النيدل.
I don't know if you can see it like this, but it's a very small needle that you barely see it.
Okay.
It's I think this is gauge 27.
It's 27.
Yeah. So it's like a mosquito
smallest
biting.
one.
اوكي سو زي قرصة ناموسة زي ما بيقول دكتور ريس لأنه النيدل صغيرة جدا وبسيطة جدا زي ما حضراتكم شايفين. Alright.
So like I say, everybody has different techniques. My techniques is see the muscle and inject it.
Okay.
Some people actually grab the muscle and inject it.
Okay.
So we use this. Can you please show me your muscle? And very good. So you can see that the muscle comes from this section and this section. So I have about 80 units of this in this syringe, which is equivalent to about 17 to 20 units of Botox.
Okay.
And it has the same effect. So here we go. Show me your muscle one more time.
نقدر نغير يعني.
Little stick here.
كادر so.
And then you inject a small amount. And then you put in different areas. And let it rest.
Okay.
So you see that there was a little bleeding there. That's very common. If you put your finger on it, then
Stop, like
the
some
bleeding
pressure.
will
Stop
stop.
bleeding a little bit.
Okay.
If you don't put your finger on it, then the worst thing can happen to you is that you get a bruise
Okay.
that will go away. So we recommend to put a little bit of arnica cream or gel, and the bruise
It'll
goes
go
away.
away.
And that's the reason some people have some swallowing.
اوكي الحقيقه لو نرجع تاني نركز مع البيشنت عشان دكتور ريس هيكمل انجكشن. How long does it take the whole procedure?
It's about 5 minutes treatment.
Okay.
It should not take more than 5 minutes.
And how soon you can get the patients in if they call today? How soon they can get it
They can
done?
see the results. They see the results in 3 to 4 days. Maximum results 2 weeks.
Okay.
We ask the patient to come back if they don't like the results. Come back in 2 weeks, and we'll just do a little touch up.
Okay, and how soon you can get them in?
Every 3 to 4 months.
Okay.
Every 3 to 4 months they can come.
All right.
So I am going to do the CrossFit. Usually, she's not supposed to be bleeding so much, but I am just going to keep the finger there until the bleeding stops. But in the meantime, I do the CrossFit. You can see this little line here.
Okay. دلوقتي دكتور ريس هيحقن الموضوع التجاعيد اللي حوالين العين اللي جنب العين زي ما حضراتكم شايفين. اتفضل. Go ahead, Dr. Reis.
So here we go. You inject it in these muscles, and she doesn't have too many, so 2 injections will be 2. Can you make some pressure? And I go back to my forehead. Go ahead and show me the muscle again, and I inject it like this. 1, 2, and 3.
Okay.
And then I go to this section again. And I'm done.
Okay. Marcella, how bad is the injection? What do you feel? How does it feel?
It's a tiny pinch. You can barely feel anything.
So it's
It's just a tiny, tiny
it's
pinch
verbal.
that you
You
feel.
can take it.
Yes.
Okay.
But you can see that there is a little swelling there, and the swelling just goes away in about a day or 2.
اوكي لو نقدر بس نحط الكاميرا اقرب شويه او نعمل زوم هوري حضراتكم شويه الجزء الاحمرار اللي حوالين العين ده حضراتكم شايفين حوالين الانجكشن بس بتروح من يوم ل3 ايام على طول. كمان في الجنب حوالين عين نورا في can you see
Yes,
like
of course.
can you turn your face tilt your face a little bit to the right. دي المنطقة اللي حوالين العين زي ما حضراتكم شايفين. مفيش تورم ولا أي حاجة. الموضوع ماشي كويس جدا. So what's expected after she goes home? Like again, can we say the precautions after the procedure, like what she can do, what she can't do?
We recommend the patient not to lay down after we do the treatment 3 to 4 hours.
Okay, so
4
3 to
hours.
4 hours not to lay down
Not
flat.
to lay down, no alcohol. We
Okay.
recommend not to drink alcohol.
Massaging, dropping.
Massage, we don't recommend massages.
Okay.
No, just leave it like that.
What about the makeup?
Makeup, they can wear makeup right after.
Okay.
Yes.
So it doesn't take so long.
No, it
And
takes
it's very
about 5
easy.
minutes.
Are you in pain again
No.
one more time? So Dr. Reyes did a good job?
Yes.
Okay. So we can call that ممكن نتصل بالارقام تاني. معلش لو نقدر نحط الويب سايت والرقم تاني ونرجع مع حضراتكم نتكلم في موضوع الفيلرز. Dr. Reyes, why do we lose volume sometimes? And we have like a huge crease, for example, in our cheeks and stuff.
So aging, it's probably the most important reason why we lose volume. When we are babies, we have some juicy cheeks because the skin is full of collagen, but as we get older,
had one
this
of those.
the collagen disappear, and the skin gets very, very thin. As we get older, older people can have skin like a paper because we just lose the collagen. But there's same thing, other effects like the elements of the sun,
Same enemies,
the
same
alcohol,
everything.
the drugs, the pollution, the sugar can affect the destruction of the skin.
Okay. So what are the fillers? When we say fillers, what do we mean by fillers?
Fillers is just a substance that will replace the volume that we lose.
Okay.
And we call it fillers because we fill this depleted area.
When we say substance, do we have certain kind of substance do we use for fillers?
Yeah, the main product of all the fillers is a substance that is called hyaluronic acid.
Okay.
And this hyaluronic acid is the main element for all the fillers.
Okay.
This hyaluronic acid is usually a component of the normal collagen. So what we do is that we just inject something similar to it.
Laura, what kind of fillers do we use today?
We are using today the Restylane Lift.
Okay.
So the Restylane Lift, it does last a year,
Okay.
up to a year, and we're going to do two. We're going to do one at each cheek, and we're going to
Okay.
use the Restylane Lift today.
Okay. So Restylane left and it lasts for a year.
It lasts up to a year. Yes,
Okay.
correct.
So for those fillers, is there any preparation for the patient before the procedure?
They're very similar to the ones that we use in Botox, so we like the patient not to drink before, not to drink after, avoid any kind of heavy duty exercise, and other substances like aspirin or Motrin, and also any kind of skin treatments like laser or retinol aid.
Okay. Before I forget, how soon you can get your patients in?
We can take the patient right away.
Okay.
There's
So
no wait.
they don't have to wait?
They don't
or-
have to wait, nothing. Just call us and we'll take you in.
Okay. The follow-up treatment or the precautions after the procedure that patient can take?
Similar to Botox, we like them to stay away from exercise, sun, treatments, massages, rest for a day, and then obviously reach me out immediately if there's a complaint like severe pain or
that's my
redness.
question. Yeah, what would be the complaints that I need to call my doctor right away, or it's like a warning sign to the patient?
Pain. Increased pain or swallowing that is not normal or that is not usual can be a sign of more complications, so we like to know immediately.
Okay. I would like to welcome Paulina to White Coat. Welcome, and you will tell us your experience and if Dr. Reyes did a good job or not. Right?
Very good.
Right.
So this is Paulina. Paulina has a significant,
If we can, show it on the camera.
so let me just put it like this. Paulina has a significant good quality of her skin. There are really minimal damages.
Okay.
If I can show you this, the upper head is actually a lot younger than the lower head.
Okay.
And I want to show you that this is a very common among all of us. The reason of that is because the sun usually hit the lower part of the head. When we walk, the sun
The
hits just
exposure
the
is not
lower.
as bad.
The exposure is usually in the lower part. So the damage is in the lower part. Here we don't use any Botox because there is no wrinkle to
wrinkles.
cure. But we use a filler. So I want to show you what happened in this section. So if you see
While
that-
you're explaining this, a question popped up to my head. Can we have asymmetry by nature in our face?
of all the time. The face is never similar to one than the other one. So when we do the treatment, we can adjust the symmetry and make it in harmony, because beauty is all about harmony. If
Right.
one side of the face is equal to the other side, you're much good looking.
Right. Symmetry gives some kind of beauty, right?
Yes.
More attractive.
Symmetry.
Better
Yeah, it's all
business.
about symmetry.
Okay. الحقيقة, one more question popped up. You said her skin in the upper part is younger than the lower part. Can
Yeah.
it happen in our skin like anybody's? Or?
Anybody.
Okay.
And the reason of that is because the sun exposure is higher in the lower part than the upper part.
Okay. Okay, let's start.
All right, so another thing I want to mention is that most of our patients that come to our office are complaining because they get this smiley line
Okay.
and they don't want it. So, and it's a very common problem. And when we explain what the reason of the treatment is, then we can resolve the problem. So one thing that we do is we tell them that the problem of this line that they're having is not an actual line problem. It's the cheek that is falling down.
Oh,
if you
okay.
can see that this cheek has a little indentation here, like a little hole, then you can understand that it's nothing but the cheek falling down.
Okay.
So gravity is another problem for this issue. So
Creases or
not only the sun. So that's why it's so important to try to sleep with no pillow and straight up.
okay.
Most people cannot do it, but it's
The
highly
last sentence
recommended.
again, please. When we sleep, what we need to do?
So lay down with no pillow if possible, or at least a very small pillow, and try to sleep with the head up.
Okay. Okay. Let's start
Yeah,
the procedure.
Another thing that also it's important to do before you start the treatment is that you need to explain to the patient what are the actual expectations.
Okay.
So she's not gonna look like 15 anymore, but we're gonna make her look a lot better.
Sorry,
so,
Paulina, we can't make you 15.
so one of the things that we do is that we show the patients what are we gonna do. Can you hold this for me and look at your face? So basically what is gonna happen is that we are going to inject some fluid in this section and here, and then your cheek is gonna go up like this.
So the smiling line will
like
be
this.
lighter, right?
Yeah,
Okay.
like that. So the idea of bringing the cheek up is because we want to get the V line. The V line is synonymous of beauty.
Okay.
The parallel lines is synonymous of old or aging.
Okay.
So when you get more fluid in the cheeks, then look at how beautiful her eyes look now.
Okay.
If you pull the cheeks down, her eyes look tired.
Okay.
If you pull the cheeks up, her eyes look full.
Okay.
So the treatment is to inject this fluid in the cheeks to make the eye beautiful.
Okay.
And
Perfect.
that's what we do.
Okay.
So we're gonna use.
Let me explain that very quick. Dr. Reyes كان بيبان ألطف وأجمل بكتير. Okay.
So this is Perlane.
Okay.
They used to call it Perlane. I keep on calling it Perlane, but it's actually Restylane.
Restylane.
Okay.
Can I have a needle? So it's pre-fill injection, so we don't have to do anything else, just pull it out. It's good only for the treatment.
Okay.
And if you don't use it, you have to throw it away.
Okay.
So again, we use a
And it
small.
lasts 1 year.
It lasts up to a year,
1 year.
correct? Yes.
Perfect.
She actually needs about 2 syringes on your side because the volume depletion is significant.
Okay.
But we're gonna just do one,
Okay.
one for each
One
side.
for
Can I
each
have
side.
some alcohol?
Yes.
Everybody is different. Some doctors like to do several injections or several entrants. I prefer to treat what the problem is, and then that's when we inject it. And if you can actually see, this cheek looks probably more volume than this
Right.
cheek. There's a symmetry. So sometimes we try to make up the difference, putting more volume in one side and not the other one. But I'm gonna start with this one.
Okay.
So you clean the area before you inject. And it's a very simple, not painful procedure. It's important to inject the fluid slowly
Okay.
because it's a very thick gel
Right.
and it takes some time to go in. It's going in. Do you feel something, Paulina?
Just a little pinch.
So the product itself has lidocaine.
Okay.
So when we
It has
deliver
its own anesthetic.
when we deliver the product, it's actually coming with the lidocaine and there is no pain.
Perfect. Okay.
So everybody, like I say, is different. Some people like to give several injections. I'll try to do the less injections possible. And the needles also is another issue. Sometimes
Is it different needles than the
you
products?
can use a thicker needle,
Okay.
a longer needle. So this time we're just gonna use the one that the company recommend,
Okay.
which I think is 1/2 inch.
Yeah, it's 1/2 inch actually.
And then you can see that my embolus is going in
Okay.
and it's slowly dropping the fluid inside the cheek.
Okay. I think it attracts more water to the skin to look more
Yes,
hydrated,
keep
right?
water and stay attached to the collagen tissues.
Okay. How do you feel, Paulina?
I feel good.
Good. All right.
Yeah, she may feel some heaviness in the area, which is very common, but nothing else. So I am dropping about maybe 1/3.
Okay.
As she tolerated, I can push more fluid.
Okay. What do you mean by tolerated? Would she feel something? Like, how do you know?
Like everything has side effects. So if you're gonna drop a medicine anywhere in the body, you wanna start slow and then go higher as the patient tolerates.
Okay.
So if she doesn't give you any sign of pain or swallowing or burning sensation, then that's a good sign.
Okay.
Which is most of our patients.
الحقيقه يعني ما عندهاش اي مشكله، كل اللي قالت ان هي حاسه بيه شويه يعني زي كانه شكل دبوس زي ما قلنا. الناحيه اليمين بتبقى خلصت تماما زي ما حضراتكم شايفين. هيبقى فيه كمان انجكشن واحد، ده تاني انجكشن، بليدنج او نزيف او مفيش اي تورم او حاجه. كل الفكره انه استعاده بس الكونتور بتاع الخد اليمين بيدي شكل اجمل بكتير.
So we're going to inject the other side.
The other side. دكتور رئيس هيعمل
Same story. I inject my fluid like this, and I start going in.
while Dr. Ray is injecting the patient, can you give us like general tips for skincare and skin beauty?
Yeah, we do recommend to drink lots of water. Water is very important. Also, a lot of vegetables. Sleep good, at least 6 to 8 hours a night, and wear sunscreen. Sunscreen is super important.
And of course, avoid smoking completely.
Of course, alcohol and but most important thing is wear sunscreen.
Okay.
Sunscreen is very important. Yeah.
زي ما كنت بتكلم مع نورا واثناء الحقن بتاع دكتور ريس كنت بسالها على ايه هي الخطوات اللي دايما نقدر نعملها. الحقيقه خطوات يعني معروفه بشكل كبير جدا. قالت ان الميه اهم عنصر من عناصر العنايه بالبشره. الميه مهمه جدا لانه درجه نضاره ورطوبه البشره بيعتمد بشكل كبير جدا على وجود كميه من الميه. تناول خضروات وفاكهه بشكل مستمر. عدم التعرض للشمس، لو هنتعرض للشمس فتره طويله يبقى في دايما سان سكرين، ده مهم جدا. كمان نقطه مهمه جدا قالت عليها، نتجنب التدخين او القعده في الاماكن اللي بيبقى فيها تدخين بشكل كبير جدا. احنا اولموست بنخلص الجزء النص الثاني من الوجه. والحقيقه انه زي ما حضراتكم شايفين مفيش اي نوع من الالم، مفيش اي نوع من النزيف او التورم، وفي تولرنس كويس قوي للبيشنت بشكل عام. يعني الحقيقه انا مش الكاميرا تقدر تشوف بشكل كبير، حضرتك تقدروا تشوفوا من خلال الكاميرا انه قد ايه الموضوع مش مؤلم، لان زي ما انا قلت مع حضراتكم معظم البرودكتس دي بشكل عام بتيجي مع المخدر، بيبقى فيها مخدر موضعي بعد فكره الحقن بشكل عام، وهتشوفوا حضراتكم الفرق. في نوع من زي ما حضراتكم شايفين هنا بس نقطه دم خفيفه طبعا، وده بيحصل نتيجه الانجكشن بشكل كبير جدا. Dr. Reis, is there any kind, because I got this question, any kind of skin cancer chances with those products from irritation of the skin?
I'm sorry, said it?
Any kind of skin cancer chances?
From this product?
Yeah.
No.
Very safe.
No, this product, it's only a natural product that happened to be in the body.
So it resembles
resemble our own molecules.
Okay.
So you don't really have any abnormal tissues or abnormal elements that is not your body.
Okay.
So you can see that there is more volume in both sides.
إذا نقدر نجيب yeah.
Can you see it?
Okay.
One of the other one. So this little hole that was there is not anymore. Like I say, she may need 2 more syringes in the side, but
How long does it take to see the result?
You see the results right away.
Right away.
Right away, and actually, when you drink a lot of water, it looks better.
Okay.
Yeah.
and then there is probably a little bumpy area. This settled in a few days and it will be okay. Maybe 3 days.
Okay. Then, thank you so much. Big thanks to Dr. Reis, Nora, and hopefully soon you get a lot of calls from our viewers and you schedule them right away. There is no waiting line. Thank you, Paulina, so much. بشكر السوشيال ميديا بتاعتنا ونشوفكم على خير ان شاء الله وحلقه جديده السبت الجاي من وايت كود.